Alright, on support of my partner's 5% patients that only make it through terminal diseases, what happens to the other 95%? Do they miss out on the chance of euthanasia if they wanted to? Also, that Jenna's example of having your mother be one of those 5% is too hypothetical as an example. And in Oregon's euthanasia law, first the patient needs to prove that they want to have the euthanasia enacted upon them before they get the two doctors' approval. So if the patient doesn't even want euthanasia, then there shouldn't be issue with the doctors having errors in deciding if the person is terminally ill or not. Then on response to the slippery slope issue, still with my partner's previous argument that in the 8 years that Oregon's enactment occurred, that with each year the amount of patients that want euthanasia has not changed at all significantly. The numbers do not jump from like 10 patients in like 1997 when it first enacted to like 50 patients in 1998. The numbers stay consistency. On a counter argument for the negative response to doctors having a case court and or using drugs, in 2006, the Supreme Court backed Oregon's assisted suicide law. In a 36 vote, justice ruled that federal drug law could not be used to prosecute Oregon doctors who prescribed overdose intended to facilitate the death of terminally ill patients. And also that on the argument that doctors should do everything they possibly can to help patients cure their pain or actually cure their disease. From the American Nursing Association in 2005, the medical community and their code of ethics, as well as the modern version of the physician's Hippocratic Oath, which they must take before getting their medical license and practicing their medicine in hospitals, explicitly support the principle of self-determination and autonomy of the person. This basically means that their first commitment is to the patient's rights and wants in their health care. So this is ends for my rebuttal.